Welcome to the ILCM training course Liver Cancer. My name is Appen Kautz and I'm part of the operating committee of the International Liver Cancer Movement, ILCM. Today we focus on the patient pathway. It's my great pleasure to have Bruno Sangro, an international well-known expert with us, and Michelle Tolley, a UK patient at risk, with lots of questions. Let's start. Michelle, your first question to Bruno.
Hi, Bruno. What can a patient do to know the risk?
Hello, Michelle. What a patient can do to know the risk is to identify whether he or she has a chronic liver condition, any sort of chronic liver condition. And to do so, it's important not to neglect any changes in liver or abnormalities in liver tests. It's important to have liver tests done at least once in a life, if not more often, and then any abnormality should prompt a patient to ask the doctor whether this is indeed a chronic liver condition, and if it's so, ask what is the risk of developing liver cancer at any stage.
How can I make sure to get diagnosed in time?
There are two things that are important to get diagnosed in time. One is consult with your physician whenever you have symptoms that may be related to the liver. Whenever you have pain, or you have your abdomen is swelling, or your skin is yellowish, don't wait and ask for consultation with your physician. And on the other hand, anytime you have a liver blood test that is abnormal, also don't delay asking to your physician whether these may be the result of a problem in the liver. Then the physician will do the appropriate test to make a correct diagnosis early.
But how can I find the right doctor?
The right doctor is the doctor who cares. It doesn't matter whether it's a primary physician or it's a specialist or a true expert. The right doctor for diagnosis is the one who makes diagnosis earlier. Anybody can do that. The important thing is that if there is a high suspicion of diagnosis of liver cancer, or there is a formal diagnosis of liver cancer, then you should be referred to a center or a network when you will find all the physicians that could help make the best decision in terms of treatment.
How to have access to state-of-the-art treatment in my country?
The best way to make sure that you have state-of-the-art treatment if you're a patient with a liver cancer is to be treated in a network of physicians, or more frequently in a liver cancer center in which doctors from different specialties, surgeons, radiologists, medical oncologists, hepatologists work together to provide comprehensive care to any patient with liver cancer.
Bruno, I have an additional question here. And so where to find these centers? Are patient groups helpful?
Absolutely. So whenever there is in your country a patient advocacy group, they do know which centers are able to provide really good care for patients with liver cancer. If in your country there is no patient advocacy group, and that unfortunately happens in quite a few countries today, then my advice is ask scientific societies. They are open to provide you with good information as to where you could be treated in an appropriate way.
And by the way, one of these international physician organizations is called ILCA, right?
It is called ILCA. It's the International Liver Cancer Association. It's a worldwide multidisciplinary society involving all the specialties, all the experts that have something to do. And at ILCA, they will be very happy to support any patient finding the right way to get access to care.
This is excellent. Dear both, thank you so much. And if you, dear audience, are interested to learn more about liver cancer, please go to www.ilcm.global. See you soon.